Croesawu pawb I briefio enw. Welcome everybody to tonight's briefing. Now, before we begin, I'd just like to provide a brief technical introduction. So we're using Microsoft Teams today, and Microsoft Teams also offers you the opportunity to see live subtitles of tonight's proceedings. And you should see a button in your settings to switch those subtitles on. Those will be available in Cymraeg and English, as well as several other languages suitable for our local communities. And Teams also allows you the opportunity to raise questions. On your screen, you should see a tab with a question mark on it, and this will normally be in the top right. If you click on this, it will give you the opportunity to pose your questions to Carol and to other members of the Health Board here tonight. So please accept our apologies that we may not be able to answer all of the questions during tonight's briefing, but we will continue to update our website with the latest information. And also this video will be available after tonight's event for you to watch at your leisure. So that means yesterday's meeting is being recorded. Don't worry, it doesn't share information about you in the audience. Only the information that you see broadcast on your screen today will be visible. That does mean that people who can't join us live will still be able to watch at a later date. So thank you so much for joining, and our briefing will now begin.
Diolch yn fawr iawn. Thank you very much, Adrian, and the team who have done a sterling job again in bringing this briefing to members of the public and our communities here in Powys. Noswaith dda. Welcome and good evening. My name's Carol Shillabeer, and it's great to be back with you. And I hope just over the next 25-30 minutes or so, just to be able to bring you up to speed, up to date with some of the developments that we have been working on here in the Health Board and right the way across Powys, and also start to think about planning for the future. So the key theme for today's briefing is about the future, and we've got some very unique legislation here in Wales around the Future Generations Act and the well-being of future generations, and that's a duty that in Powys Teaching Health Board we take very seriously indeed. So I'm delighted to be able to spend a little bit of time looking ahead. The first thing I do want to cover, though, is just bringing you up to date on the areas that we've been investing in more recently. And for those communities that are in and around the Machynlleth area, you will have been seeing and getting a bird's eye view of the developments there at the Machynlleth Hospital site. And a lovely sunny day that looks at the photograph of colleagues who have been helping to develop the refurbishment of the Brodyfi Hospital site. And many people will know this has been quite a long time in the development, and we've had a couple of hurdles we've had to overcome, but overcome them we have. The £15 million redevelopment of the hospital has been funded by the Welsh Government. We've been extremely grateful to receive that commitment from the Minister for Health and Social Services. And that investment really is to develop, create an innovative community hub to improve health and social care, wellbeing, prevention and health promotion services in the area. It also importantly provides a new home for the Dyfi Valley Health practice, and I'm delighted that being able to offer a more integrated approach, so services under one roof, is now a distinct reality just in the next few weeks and months. So I'm very much looking forward to the commissioning of that new development and seeing its use by local people. Our next investment has been in relation to Brecon Hospital, and for people who live in and around Brecon, we've been investing for some time in the hospital itself there, and we're very proud we are of the services that we provide there, including theatre services, outpatient consultation, dental, maternity care, inpatient care, a very vibrant function indeed. But we have been beset by the challenges of parking and access. So absolutely delighted that with the help of local people, and donations and support from Welsh Government, who hardly ever provide support for car parking, we have been able to now create 70 additional car parking places, and that reduces the pressure on the main car park, so patients, carers, visitors are able to use that facility more easily. And that's part of our Care Closer to Home developments that we worked on with people across the communities of Powys when we were developing the health and care strategy. So these things are becoming a reality in front of our eyes. So huge amount of work gone into that, and I'm absolutely delighted it is now fully open. And for those of us with an electric car, charging is going to be available soon there as well, so be able to charge that your car whilst you're having your appointment. The next area of investment is in Llanidloes Hospital, and wonderful picture there of a newborn baby, and it is the birth centre at Llanidloes Hospitals having a facelift, and I'm delighted that we're investing in facilities that mean local people will be able to access those services closer to home. And we know that our midwifery-led services are a jewel really in the crown of maternity care, and we're very, very proud of those services. So the refurbishment will add an extra great experience, I hope, for people who are using them. It's going to be larger, and we'll be able to host a new birth pool. So there's, I hope that will be attractive to many more people. We'll be modernising other parts, so the bathrooms and all of those sorts of things. And just to enable us to do that building work, we have temporarily closed that unit while that work is happening. At a future one of these briefings, I'll be very proud to show you the pictures of the refurbished centre as well. There is a new sensory garden, and the League of Friends I'd like to say a special thanks to, because I know that through my own experience in meeting Leagues of Friends, and in particular the League of Friends in Llanidloes, the commitment that is shown to our community facilities right the way across Powys is something for us to be extremely grateful and proud of. So diolch yn fawr. The other area for me to just update on is the investment in the future at Knighton, and you know, out of real challenges at times come real potential opportunities, and sometimes, you know, considerably better services. And I'm really pleased to be able to say that despite us not being able to recruit sufficient registered nursing staff to reopen the inpatient ward there, we know that local people have spoken to us about could we provide some other alternative type support for people who are stepping down and out of the District General Hospital, waiting for a community care support package, for example. So we're able now to provide 4 reablement beds at Knighton Hospital, and you know, I'm really hoping that these beds will be extremely useful in supporting people to get closer to home, ideally on the way to their own home with the right level of community support. Our aim is to open those that additional facility within the next few weeks, and certainly into April, and we'll be looking to evaluate the impact of that. We're going to touch on some of that a little bit later on in the presentation about the changing needs and the changing requirements, I think, for us as a health board to meet local needs in a different way where appropriate. So this is a great development. I'm very grateful to local community leaders who have worked with us in the health board so far on this development. For the next slide, though, I just want to return to something that during these public briefings I've touched on at very regular intervals, and that's vaccination. Of course, we started these briefings at the beginning of the pandemic to share with you that some of the key issues and the really important messages of how we were managing through the pandemic, and hence, it stood the test of time that we're here now in 2023. Vaccination, of course, remains our best defence against COVID and other viruses, and winter viruses in particular. And just a couple of important announcements here. The COVID-19 booster from the autumn ends on the 31st of March. So if you've not got round to it, you've got a small window. Please do get along to one of our vaccination centres to have your booster. That's going to be really key, particularly depending on what category you are in, because a couple of other bits of news here. Our first and second dose offer will end on the 30th of June. So if you have up to now decided not to, or you haven't had a chance to have a COVID vaccination, be that the first one or the second dose, then they will be available only until the 30th of June. So please do reflect on whether you feel you're now in a position to come forward to take advantage of that vaccination. As you will know from watching these briefings, we've had the most tremendous response from the people of Powys to vaccination, and we're so proud of the efforts of everyone, be it in the health board, in the third sector, in local government and other partners, and of course the population in achieving a tremendous uptake of vaccination. It's not done yet, and literally just hot off the press, the 2023 Spring Booster Programme has now been announced. And if you are over 75 years old or 75 years and older, if you live in a care home for older adults, or if you are age 5 and over with immunosuppression, you will be invited for a spring booster. So we will be making contact with you if you are in those categories over the next couple of weeks and months. And as I say, vaccination, best defence against these viruses. Whilst we're on protecting ourselves, it's a funny old thing, isn't it? Here we are in March, and the daffodils have been out, and along comes a big dumping of snow just when we thought we'd got away with it. But please just, as always, do take extra care in the snowy and icy weather. We know that many of the accidents that happen, slipping on ice, etc., we can be preventing those if we can take some extra precautions. And I know the neighbours, friends and communities in Powys are so strong, so I'm sure we'll be looking out for one another, and particularly our more elderly neighbours and friends. So that's my general update. In terms of the next section, really wanted to start to focus on health services in the future, and to start with a thank you, really, because there have been some consultations and engagement exercises that people across Powys and in different parts of Powys have been participating in, and to huge thanks to people in Gilwan, which is literally just outside the border of Powys, but very much connected to the Crickhowell practice, Belmont Branch Surgery in Gilwan. I was delighted to have been able to attend a public drop-in event a few weeks ago and met lots of people from the community. We were talking about those local services. So your views are very important to us. Thank you to everyone who was able to attend, and to those people who have written in and given us your views. We will be now considering those views and analysing the range of opinions and reviewing those in order to help make a decision moving forward. Other engagement opportunities have taken place as well in terms of the cochlear implant and bone conduction hearing services in South Wales. That engagement has also now ended, and further updates will be available later this spring. For those members of the Powys population who live a bit more in the west, in terms of the Howell area, there is currently a consultation underway in terms of the location of the new emergency and planned care hospital. That facility will replace some of the services currently provided at Glangwili, but just for information, services at Bronglais in Aberystwyth not affected by that consultation. And just finally, we wanted to indicate that the Public Service Board, that's all the public services that work together in Powys, are consulting on a draft wellbeing plan for Powys, and we've put the website there, haveyoursaypowys.wales, and it'd be really great if you are able to have a little look there about and be able to comment on the things that matter most to you and your own wellbeing. We are expecting more information soon as well on EMERTS, that's the Emergency Medical Retrieval and Transfer Service, part of the air ambulance work jointly between the Welsh Air Ambulance charity and the NHS. So I know we've touched on this matter previously, but we are expecting more information to be available soon on that. So just moving on, again, in the lane of the future, I wanted to turn attention now a little bit more to planning for the future in Powys. We are at the halfway stage of our health and care strategy here in Powys, called A Healthy Care in Powys, and it was published in 2017 and will take us all the way through to 2027. And even though it's 5 years old, much of that strategy is still extremely relevant for today. And I think that has stood the test of time because of the quality of the contributions from members of the public and stakeholders way back in 2015 to 17, as we say there. Absolutely excellent. I'm so proud of the development of that strategy. But I guess, there are some things that have changed since that time. Who would have known that we had a once in a century pandemic on its way, that there would be a war in Europe, in terms of the invasion of Ukraine and the economic issues and challenges that have arisen partly as a result of that, and is having a really significant impact. We've got a whole host of real challenges. Diagnostic and treatment of thousands of patients remains delayed. People delayed in hospital at risk of deconditioning, and I'm sure almost all of us will know somebody who's got stuck in hospital, either trying to get out or actually trying to get in. We've got inequalities and deprivation, including, child poverty, and that's a significant concern to us, as well as, of course, the things we have known and perhaps been re-emphasised of late, which is the changing demographic of our population, more older people than younger people, our challenges in workforce. And those factors coming together have meant that sustaining services in the way that they've been delivered now for decade upon decade is becoming more challenging. And this is a shared challenge with our key partners in Powys County Council. And I know that together we're trying to think about, well, how do we prepare ourselves for the future? It's not going to be of use to just stand still. We have to keep moving forward. So I've got a couple of slides just to share with you the approach that we're taking to try to just make sure that we're planning ahead really well, so that we're not buffeted about by those challenges and having to take sort of emergency or temporary service change decisions. And then above and beyond that, how we proactively help to support people to stay healthy in their home or close to their own home. So we've undertaken something called accelerated model, and that's really thinking about discover, design and deliver. So what's happening, what's expected to happen, what are our gaps in services, and it, really importantly, what are the opportunities that we have with technology, with all sorts of different research and development that has been happening for many years in the NHS, new drugs and new techniques in healthcare. How might we take all of the learning from the discovery phase and start to design with people the services for the future, and then how do we implement those? And then on the right hand side of this, we've tried to take a view on this through different lenses. So the population, common conditions, people in places. We know that place is really important in Powys. Cross-border, our patient outcomes and experience, as well as money, our buildings and our digital connectivity. All of those things have been really important to us. In terms of where that's leading us, I guess it's really key for me to just draw our attention to the very fundamental changes that have been happening. I've got a slide here of the census data, and if, like me, you're a lover of data, then I'm sure you could lose a few hours on the ONS census website and have a look at all the really interesting different graphics that show how our population has changed over this time. So there we are, just shy of 28% of people in Powys are 65 years and over. And whilst the overall Powys population is only forecast to grow by 1% over the next 20 years, the age of that population will grow, and there's some very key evidence about as we get older, we consume more services. We have a need for more support, be that healthcare or social care or other services as well. So we have to plan ahead for the future in order to meet people's needs. If we move to the next slide, it just helps to demonstrate, I think, we've been taking a look, not just as Powys as a whole county, but the very different areas of Powys. So we're at the forefront of the ageing population, and for some parts of Powys, already a third of the population is over 65. So Crickhowell, for example. So 33% are 65 and over. There are some other areas that are very different, and this is the area that Newtown South that stands out with a much younger population, but that's the exception rather than the rules. And then there are 5 local super output areas that are the most socioeconomically challenged, and they're very much in our minds about supporting people who perhaps have lower levels of income and lower levels of health and well-being as well. So just in terms of the next slide, just very briefly, I would just share with you, we've taken a look at the common conditions that people have here in Powys, and this was reinforcing of the work that we did when we were developing the health and care strategy. So what are the big conditions that people have? And we've just reinforced through this relook at the data the importance of cancer, cardiovascular disease, respiratory, mental health conditions, including also frailty of memory, so dementia. All of these are really important, and we've got a high prevalence of these illnesses here in Powys because of the profile of the population. So we will need to be focusing on these areas. In terms of the next slide, it just shows a sense. I'm not going to go through this slide. And these will be available after the presentation this evening. But it just goes to show that there are many different parties and organisations involved in pathways of care for the NHS, and that works from GPs to community hospitals, to community services in Powys, and then acute care services outside of Powys, and to some extent specialist services that may be even further afield. So quite a complex landscape for us here in Powys. The next slide, really I want to underline something we probably are all aware of, and that's about frailty and the risk of deconditioning. So about 10% of people aged over 65, and about a quarter to a half of people over 85 are living with frailty. As somebody who has elderly relatives, living with this situation day in, day out, I know how quickly that becoming frail can knock confidence and the increased chance, risk, if you like, of being admitted to hospital and then trying to get out of hospital in a timely way has been a real challenge. And we have that challenge as a really significant issue here in Powys. And just this slide shows that the profile of the services and the needs are such that we need to start to think very differently about how we support people who are older in years, who are living with frailty and are at risk of deconditioning. So that means getting worse when they are coming into hospital. Just moving on to the next slide. We add to that workforce challenges, and I touched earlier on Knighton and the issue we had in terms of recruiting registered nursing staff. We know that that's a UK issue. In fact, it's beyond the UK, but we also know that other staff groups as well, not just nursing, the global workforce shortage that is occurring at the moment is a challenge to us here in Powys and will be everywhere. So thinking about how we overcome that is going to be key. The next slide gives us a sense of well, where are our services currently? And I've been very proud in my time in Powys to be able to say to people that we've got such a strong network of primary and community services, and they're really primary care as the backbone of provision here in the county. So that's GPs, pharmacies, optometrists, dentistry, all of whom have their challenges as we move through these wider issues. But we've got, district nursing teams, virtual wards, health visiting, community therapy. But what is really clear is that if we are able to deliver on the wishes of the people of Powys, most people wish to spend more time in their own home rather than be in hospital or in other places. So we need to be increasing our ability to support people in their own home. So how we organise ourselves is going to be really key. Next slide, please. I don't plan to go through this apart from just sort of making reference to these really quite fancy graphs. And for those people who watch this who love that sort of thing, I think these are Sankey graphs. They are quite complex, but so is Powys in many ways, because we've got so many different cross-border flows. The intention of this slide is to say actually Powys is quite complex, but we need to therefore try to simplify our relationships with our bigger district general hospital partners, both in Wales and in England. And at the moment we are working with five regions across England and Wales. And whether you access your care in Shrewsbury, Wye Valley, Cwmtaf, in Aberystwyth, etc., these interfaces are very important to us, but they do bring a complexity that we need to navigate. Next slide. I want to talk just for a moment about diagnostics and planned care, because when I talked about how the NHS is changing and how new technologies, new developments, new clinical care is coming through. This is the ideal example of this. So who'd have thought that we would have all been testing ourselves in our own home for viruses, COVID-19 virus, for example? You know, the development of that has been phenomenal, really, and we've all engaged really well with it. And that leads us to be a bit more confident that we can develop more testing, more diagnostics here in Powys, working with our partners in district general hospitals and in other settings, but certainly doing a lot more closer to home. And that's true also of planned care. So I've just mentioned Brecon earlier with the car park, been enhancing the amount of surgery we do, day case surgery and procedures that we do in Brecon and in Llandrindod Wells, and we have an ambition for that in terms of North Powys, of course, with the North Powys Wellbeing Programme. But there is even more that can be done now. So in the old days, procedures that used to take place in a main theatre moved to a day case theatre, and procedures in a day case theatre are now moving to what are called procedure rooms. So quite a lot of opportunity here, and I'm very, very keen to exploit that opportunity in bringing more care closer to home for the people of Powys. Moving on to the next slide, it's very difficult to escape the country's financial challenges. Almost every day there are news reports of the different impacts of the cost of living crisis and the public sector spending challenges, constraints that the government has. So we've been looking at, well, where does the money get spent? And this shows that as we get older, more of the resources spent in our latter years. And the key question that we've got is, are we spending that money wisely and in the right place? And how might we take that money and spend it in a different way to get better support for people, particularly in their own homes? So that's going to be a key consideration for spending this scarce public money, the public purse, to get the best experience and the best outcome for people. Moving on, finance, I just to share with you openly that sadly this is the first year since 2014 that the Health Board will not break even. Break even is balance in the books, and we're looking at a potential overspend of about £7.5 million. I'm hugely disappointed with that because people have worked so hard to manage the pandemic, manage the backlog, and manage the money. And with inflation at a really significant high, we are subject to all of those inflationary pressures that have been happening in our general lives as well. I know that Powys County Council are going through exactly the same thing. So working together, we are committed to trying to support the people of Powys through those better and stronger relationships. So money is a key factor, and I have to be open and honest with people around that. Next slide, please. So some of this may be familiar to people who tune in a lot. So what are we going to do is, with all these challenges laid at our door, how are we going to navigate them? And I mentioned earlier a healthy caring Powys. It's our health and care strategy, and so we are looking to that to help us on the next leg of developing services more locally that meet the needs of people. So integrating health and care services, I've mentioned our work with Powys County Council, trying to develop more services in our rural regional centres, so Newtown, Llandrindod and Brecon I have mentioned already, trying to use digital technology to support access to care, and a phenomenal number of people are using digital means to access care and support. We know it's not for everyone, but where it does work, it can provide a really, really helpful way of gaining support without having to travel. We know that there's more to do on a whole range of elements to enable us to be more sustainable. And the time is short tonight, so I won't be able to go through them all, but I wanted to at least start to share some of the thinking that we've been doing, because sustainability is both a legal duty as well as a moral duty for us. And learning from the pandemic, everyone matters and everyone matters equally, although not everyone is treated the same, and the interests of every single person in Powys are of concern to us, and of course I know to wider society, and our ability to prevent harm is really important to us. So this is the legal framework, if you like, that helps to drive us forward. And the next slide, we're nearly at the end. And so what are we trying to achieve? Well, services that can be accessed by residents of Powys that are high standard. They meet the standards. We serve the appropriate population level throughout Powys. Now, we know not everything can be provided in the home, but we want to provide as much as possible in the home or in the local community. We want services that are resilient, that they're environmentally sustainable, that they're fair, and then importantly, we want solutions and services that work across the whole system. And then I think just in terms of tying up this presentation with the last slide, we're starting this conversation about planning for the future in Powys. It is the 75th anniversary this year in July of the establishment of the NHS, and it feels a really important time for us to be having this conversation. I've been in the NHS for 30 odd years, so nowhere near the 75, but a good proportion of it. And I'm constantly amazed by how resilient the NHS is, but how much we have changed. When I started in the 80s, it looked very different to where it is now, and it perhaps does get sustained by making sure that we change, we update, we take into account new developments. So that's the lens we're looking at this through, and there are some important key questions for all of us living and working in Powys. So the descriptors that I've given quite quickly through those slides, is that a picture that you recognise? And if not, what is missing? We're very interested in your views. What are the biggest priorities for improving care and wellbeing in Powys? Are there issues and challenges that we need to address that we haven't flagged so far? And what do you think we can do to address those issues? And then how can we support you to work with us? Because the key thing for me about Powys is the strength of community and our ability to work together to build something better for the future. So as we celebrate the 75th birthday, the anniversary of the establishment of the NHS, we're wanting to work with you to ensure that really we can build an NHS that's thriving at 85, 90 and 100, so 25 years from now. So Jochen Vau, thank you very much for listening, and just to wrap that bit up, that if you do want to contribute your thoughts to those questions or other questions, we will be publishing these slides, the presentation on our website, and there will be a mailbox that you can drop your views and thoughts into, and we will be very grateful to receive those. So thank you very much indeed. I have not gone as quickly as I expected to there, but I'm going to hand back to Adrian now to see if we do have any questions this evening. Diolch, Adrian.
Thank you so much, Carol. I think reflecting as well, my first contract with the NHS was just over 30 years ago. So between us, we've probably got close to 75 years of service with the NHS, but I don't think either of us were quite around at the founding of it in 1948. But I certainly know that we're both passionately committed to making sure that we've got an NHS that's fit for the future, as our own demands on it and of those around us will increase in the years to come. Now, there was a heck of a lot in that presentation, wasn't there? A lot of detail, a lot of information. So I guess as a member of staff and as a resident, I'd like to thank you for your transparency and your openness about those challenges and opportunities and the debates to come. I'm also delighted to say that we've already delivered on one of your promises, because the presentation slides are now on our website for anybody who chooses to read them. And as you said, we'll shortly add a mailbox and survey so that people can provide comments as well, and start this conversation that's at its early foothills, really, but we'll need to carry on that debate in the weeks and months to come. So thinking about some of the questions that have come in, I personally I'm looking out against a very, very deep snow scene from my window here. So with heavy snow across the region, what's the NHS doing to respond to that, and how well are we coping?
Yeah, well, thanks very much, Adrian. I mentioned this dumping of snow in March. It should never be allowed, is my view. I thought those daffodils were here, standing tall. A couple of things really. The great news is we have adverse weather policies, and we try and we test these policies, and we were testing them certainly in the summer. So what was it, 6 months ago? We had quite adverse weather in terms of the heat. Now we've got the adverse weather in terms of the snow, and so we have policies that we use regularly. The key thing for me is the spirit of our staff across Powys and our community. So as always, people pulling out the stops to try to get to their patients and to try to get into hospital settings. We have a great network of leaders and managers across the health board who are flexible to try and support staff and residents to access the services, to keep the wheels turning. And so far, so good is what I would say on that, Adrian. We never take things for granted. I do remember, and I'm sure you will remember too, Adrian, a couple of years ago, when we were in full flow with the vaccination programme, we had snow and we had to double up the day before in providing the service for people. So adaptability. So if people have had some disruption to their services, we will be getting to support you as soon as we possibly can. But on the whole, Adrian, it's been a business as usual approach.
Thanks, Carol. I think that might have been January the 30th, 2020. Not that it's a date that's etched in my brain at all from the last couple of years. So thanks for that. And again, thank you so much to all colleagues across the health and care system, right across the public service and in commercial services as well, who've been working so hard in these weather conditions to keep services running. Obviously, within the health board, if we know that a lot of people go above and beyond, particularly during snowy weather. So if there's somebody that you want to commend within the health board, remember our certificate of appreciation process is always open. Those nominations won't quite get in time for our next event next week, which will be a lovely opportunity to celebrate great colleagues who've been doing wonderful things. Now, thinking about staff relationships, another question that's come in is, well, tomorrow's strike action by Unite in the ambulance service has been paused. Now, I know that NHS pay isn't determined locally by individual health boards, but do you think there's some glimmers of hope here after the industrial action that's affected all of us over the past few weeks?
Yes, thanks, Adrian. Well, I certainly hope so. And I'll go just a step further, but I don't want to jinx anything. I know that all parties are having discussions. I'm aware of that. And I think all parties are wanting to find resolution to the areas of disagreement and dispute. And I certainly hope we're getting closer to that. The fact that industrial action, strike action has been paused is a good sign, means that people do want to find solutions, and I'm hopeful, or ever hopeful, that in the next couple of days we will get some good news on that. You know, as we said, we've been in the NHS a very long time. People don't take strike action easily, readily. And so I know that this will have been weighing heavily on people's minds. So we absolutely appreciate that this is a really tricky time, and we're really pleased that the government and the trade unions are having that dialogue.
Thank you, Carol. And I think just conscious of the time here, so maybe time for one last question from those coming in. You mentioned earlier about NHS 75. Are there any particular plans underway to mark that? And have you got any plans personally for the NHS 75th birthday?
Well, it seemed only 2 minutes ago we were celebrating NHS 70, so I'm not quite sure where the last 5 years have gone, but absolutely, these are important milestones, not just for the NHS and the staff that work within them, but for all the good and all the challenge that there is in our country around accessing the NHS, it is still seen as internationally as a real treasure. And it will be important to mark and to reflect and to think ahead. So I'm hoping and anticipating that we have a range of both celebration and other engagement events and opportunities that help us to think, be thankful and to think ahead. There is one that I'm going to have to get in training for, and that's the park run. So I think we're able to say this, that there's going to be a park run for the NHS to celebrate, thank and recognise all of the work. And I think we've got that on July the 8th. So it gives me a couple of months to get my running shoes on and get a bit more prepared. I haven't done a park run since before the pandemic, so I better sort myself out. I would, really want to promote that and to welcome people. You don't have to run, you can walk, you can chat, enjoy the outdoor space, enjoy the activity. So that's just one thing, Adrian, and I think we'll be able to make our staff, our stakeholders, members of the public aware more and more of those opportunities to engage with the NHS 75, but that's just one for the diary so far.
And definitely big thanks to all of those volunteers who make those park runs happen. I know in the county we've got them in Newtown and Bilth. I've taken part in Newtown a few times myself, but definitely similar to you, I need to get back into it. Probably that means there's not been a better time to think about getting back into exercise. There's useful apps like Couch to 5K, aren't there? But you can walk, you can amble, you can jog, you can come and chat along with your friends and take part in park runs. So just go onto that park run website to find out more. And yes, it'll be in the NHS birthday week on July the 8th. So thank you, Carol. Just now an opportunity for any final comments that you want to make before we close tonight's briefing, and thank you everybody for joining.
Well, diolch, Adrian. Thank you as always for hosting these briefings. I certainly hope that they are informative and useful for people. Please do tell us what you think. Your views are always welcome. And I guess my final thoughts are we're coming through winter, although hard to recognise that with the snow, and we're moving towards summer, and the ability for us to have bigger conversations about the future feel really important and very timely, not just about in relation to the NHS at 75, but in relation to moving further and further out of the pandemic, and I hope into a longer term sustainable service for the members of the public in Powys. So please do, if you are watching this, engage with us, have the conversation. I would be very keen to hear your thoughts, and very much look forward to working with you and for you over the coming months and years. So diolch yn fawr, have a lovely, warm, I hope, evening, keep safe. So thank you very much. Good night.